As the Texas Ebola patient's conditions worsen and the infected NBC cameraman is under evaluation, 22 News reporter Julie McDonald looked at why doctors still say there's no need to panic.
As the CDC continues to monitor the 2 U.S. Ebola patients in isolation and dozens of people with whom they interacted, the Pentagon is sending 3,600 troops to West Africa to train health workers and build field hospitals.
It's scary, and now our troops are over there and they can get it, and you got to be careful of everything.
The nation's top infectious disease expert said it's understandable Americans are anxious of the unknown, especially after what he called an initial misstep when a Texas hospital sent an Ebola patient home who had symptoms and said he'd traveled to West Africa.
Physicians in emergency rooms and clinics now will be overly aware that when someone comes in with symptoms that are compatible with Ebola, you get a travel history and you communicate that to the doctor.
But he said that fear is unnecessary. There will be no outbreak in this country. The main reason people don't have to fear an Ebola epidemic in the U.S. is because the way it's transmitted. It's not an airborne virus. That means it's not going to spread easily like the flu or a cold, even the measles.
The transmission for Ebola is the person's body fluids in contact with that individual.
The CDC is getting about 800 calls a day about Ebola, and that could increase as we head into flu season. The initial symptoms of Ebola, fever, body aches, and abdominal pain, are easily confused with other illnesses. Julie McDonald, 22 News.